Eyolfson for 5 minutes.
Okay, thank you, Mr. Chair. Thank you, Minister, for coming. Having practiced medicine for almost 20 years, I certainly, this has been an issue near and dear to my heart, as I've said in my remarks during the debates. Just to refer to some studies that were mentioned by my honourable member across the way, suggesting a link between plain packaging and contraband tobacco and its associated terrible crimes. Are you aware of any research that is not sponsored by tobacco companies or their paid lobbyists that makes claims, that is credible research that makes claims that there are increases in contraband tobacco due to plain packaging?
Thank you very much, Dr. Eyolfson, for your question. And no, in actual fact, the information that we've received is very clear that plain packaging absolutely works. It's certainly an approach that many countries have used, and we see studies time and time again that they are very, very effective. There was even a Canadian study that was done recently that it showed that young Canadian women were 3 times more likely to smoke cigarettes from a branded package as opposed to plain package. So again, we certainly recognize that when we look at the issue of plain packaging, it's certainly effective, it's less attractive to smokers, and especially our young population.
All right, thank you. Likewise, there are claims that there is contrary data on the rates of smoking and that it does work or does not work. And I spent a lot of time going through the research. We had one witness that pointed out from the Canadian Cancer Society, I believe, that actually had a stack of 150 peer-reviewed studies that showed the effectiveness of plain packaging on smoking rates, and yet there's some say that the jury is still out on this. Again, in a similar vein, are you aware of any non-tobacco company-sponsored or tobacco lobbyist-sponsored research that makes a credible case for plain packaging not working on decreasing smoking rates?
Yeah. Once again, I have to reiterate my previous response to that. The information that we've received certainly shows a direct correlation that plain packaging certainly does help and assist in reducing the rates of tobacco use. And once again, I had the privilege last week or 2 weeks ago to meet with the Canadian Cancer Society, and they also shared with me a lot of information that was based on research and science that they were able to share with me. And the evidence is really quite overwhelming that plain packaging, when it comes to tobacco, absolutely is an effective way, to see the downward trend of tobacco use.
Mm-hmm. Thank you. The experience in France was brought up a little earlier. How long ago did France initiate plain packaging?
It's been going on over a 3-year period, and I believe that the actual start date was in 2017. So we certainly have seen, when we looked at the trends, that there was quite a significant amount, a percentage of smokers that stopped smoking was during the beginning of that transition phase, but we're still looking at that information very, very closely. But preliminary findings show that there's certainly a link there, but again, we'll certainly continue to look at, the evaluation.
Mm-hmm. Thank you. Now, on to vaping. I know that there are, I appreciate the fact that you want to make amendments restricting the advertising of vaping. Now, there are those, we've heard some claims that, vaping is, less harmful, and that, yes, in itself is less harmful. Are you aware of any trends or research indicating that those who've never smoked, who start smoking or who start vaping, are likely to go on to smoking tobacco?
I haven't seen any specific research with respect to that, but with the proposed bill S-5, that's why that it's really important for us to strike that balance. We really want to make sure that we in no way promote vaping, the vaping products to children that are under the age of 18 or to promote it to anyone that's a non-smoker at this point in time. We don't want to create another generation of people that are addicted to this substance. So that is why, with respect to our marketing and our promotional types of material, we're very restrictive to ensure that they don't encourage young people to want to start this habit. But with that being said, as I've also indicated, we also recognize that it can be a very good harm reduction type of approach when it comes to smokers. So we certainly want to ensure that the products are available for those smokers right now, with the hope that they are going to be able to wean themselves off. I have to share with you, if I have the time, Mr. Chair.
You're done.
Okay, I will continue on next round. How's that?
Okay.
Thank you.
Thanks very much. Okay, now we go to Mr. Elvis for 5